Good evening, I'm Adrienne Arsenault.
And I'm Andrew Chang. It is December 1st, the beginning of the final month of 2020. As of this moment, more than 380,000 Canadians have had COVID-19. And today we saw more than 5,000 new cases.
So we're obviously at a critical point. All of us have hard choices ahead. We know this isn't easy, and tonight we will hear from you, your hopes, your fears, your experiences, and how you are confronting COVID. Right now, millions of Canadians are locked down with a lot to think about. COVID-19 isn't just deadly, it is exhausting, exasperating, and revealing.
The pandemic has exposed some glaring cracks in our system. And for many, infection is not the only threat. Our stability and well-being is built on freedom of movement, trade, and ideas. Ever-tightening restrictions help slow COVID spread, but can also amplify disagreements.
And over 8 months later, we all feel it. It's hard to turn on the news, to get up for work, if you still have work. To face the lineups at the store, it's like wearing a backpack full of bricks every day.
And yet, as 2020 winds down and the holidays approach, we persevere. We have not had the staggering rates of infection and deaths seen elsewhere.
The economy is functioning. Hospitals are, so far, meeting the challenge. And with news of several promising vaccines, the weight starts to feel a little less crushing.
But if we let our guard down, we risk giving the virus a bigger opening. In the end, it comes down to choice. Give in to fatigue or stay vigilant and beat it together.
So welcome. We are live in the National Studio in Toronto tonight, the city where millions of Canadians are in lockdown. As you all know, the latest numbers across the country are pretty staggering, but numbers do not tell the story. People do.
Yeah, and so tonight we're going to hear from Canadians right across the country, live and on video, to share their stories and ask their questions. Canadians across the country also joining us on Zoom, our virtual audience tonight. Hello to all of you. But hey, the important part here, we're not the ones setting the agenda tonight. You are, with the goal here being clarity, guidance, information. And we've got doctors on call to give us exactly that. Dr. Shimi Kang joining us as well. Zain Chagla, Danielle Martin, who will try to get her image back in just a moment here. Samir Sinha in the bottom left, Taslim Nimji, and Isaac Bogosh. Hello to all of you. So listen, there's so much ground to cover. Let's get right to it with a look at how we're all confronting COVID. And our first question is about the holidays.
Thank you for taking my question. It concerns Christmas. We are a couple in our 70s, both with health issues. Our adult child teaches in class in a lockdown area. There are cases of COVID in the school, and several classrooms have been shut down. Is there any way to safely include our adult child for Christmas dinner or overnight?
So what do you think, Dr. Bogosh? Christmas dinner between, I guess, potentially higher risk family members?
Yeah, as much as we want to say it's going to be okay and there's things that we can do to do this safely, you got to be very careful with a situation like that. Certainly, it sounds like this person who's in the school is potentially at risk of exposure and then, of course, might be going to another place where he's got elderly parents and he could put them at risk of infection as well. It's an indoor environment. It's in close proximity. You got to be very, very careful with that. So, you know, as much as we're trying to say, here's how you can do things safely and here's workarounds and here's ways that we can sort of still live our life but be responsible, something like this, I think, we should be very careful with. And I don't think there's going to be a way to do that in a very safe or completely risk-free manner.
All right, Dr. Bogosh, thanks for that. Let's go to our next question. This is coming from Lincoln, Ontario.
Hi there, my name is Lena Nielsen, and I live in the town of Lincoln. This is my question. We are constantly being reminded to wear our masks, but why is there not more emphasis and diligence in wearing our masks correctly by covering our nose and mouth? Further, encouraging business management to ask those not in compliance to wear their masks correctly or leave.
Dr. Chang, can you maybe take this one? Because this is a health question, but it's also, I mean, it strikes me as a behavioral question, right? It's a social question too.
Right, Andrew. And this pandemic has been so hard on everyone. And we have to remember we wear masks and we wear them properly, not just for ourselves, but for our community, for the elderly, for our frontline workers and those with underlying health conditions. My mom is 83 today. It's her birthday. Happy birthday, Gyan Kor Chahal Kang. And when I asked her what she wanted for her birthday, she said she wanted to remember the message of the great Guru Nanak, who was celebrated around the world on Monday. And that was the message of empathy, of oneness. We are one human family, and we have to really approach this pandemic with that mindset and really go beyond our own thoughts and into this idea of greater good. I like to teach people the dolphin metaphor because dolphins have a lot of empathy. And when you're around people, ask them to be firm and be firm and flexible yourself. Don't be a jellyfish and allow things to come and that are unsafe for you. Don't be a shark and be rude and aggressive. Try to be collaborative, empathic,
Right.
and in those words of my mom, to really have empathy and remember we are one.
And Adrienne, I mean, those are really important things to keep in mind because it's a pretty common situation, right? I mean, I take the subway in to work every day. I see people every day with their masks down just over their mouth.
And there's a paralysis, right? You don't really know what to do. I'm writing that down, though, be a dolphin. So along the lines of behavior, let's go to another question. This is from Laura in BC.
My question for you is linked to the increased friction we're seeing between different groups of Canadians. Canadians who believe that COVID is real and they're taking the appropriate actions of protecting themselves and others as mandated by their provincial health authority, and those Canadians who are still at odds with that and are defying the orders. So we're seeing very unfortunate incidents happening, and I'm wondering how are we to manage this?
Okay, again, thanks, Laura. So, Dr. Martin, this one's for you. Again, we're talking about navigating behaviors here. This is a medical crisis, but it's a behavioral one.
It is, of course, all of the above, and there are no easy answers. And I think it's also important to remember, as we've already been discussing, that everyone is tired, and that most of us are doing our best, and nobody is perfect. And so, there are things that we can do as individuals in terms of our interactions with folks we bump into who are not adhering to the public health guidance, in having those empathic yet firm conversations and interactions, and giving people the benefit of the doubt. I statements are really helpful there. You know what? I'm exhausted about wearing my mask too. You may not realize that yours has slipped under your nose. I have an elderly parent at home. Would you mind pulling your mask back up to cover your nose? But there are lots of other things that can be done at the policy level. And this is why it's important for governments also to take action.
Okay, Dr. Martin, thank you. Again, the empathy piece of this is really important. Let's stay out west. Go to another question from Bill in Victoria.
Why does Canada have few hospital beds compared with other countries? Our lack of hospital beds limits our capacity to deal with this pandemic. Japan has relatively more hospital beds than all other countries, 13 beds per 1,000 people. Most countries in Europe have 5 to 8 beds per 1,000. The US is down near the bottom, 2.8. But we're even lower, just 2.5 hospital beds per 1,000. Back in my 30s, we had 7 per 1,000. Can we double our hospital beds?
So, Dr. Nimji, this is a really good question. And I confess, I didn't know these details that Bill is offering. But now I'm just as curious as he is. Why is it so low? And as he asks, what can we do?
So I think we have to think about care delivery models and understanding that there is a shift away from delivering so much of our care within acute care centers. So that's hospitals. So you can see that there's a big emphasis on home care and community care, on complex care and rehab beds that are not taken into account when we're talking about acute care beds. And also, as we really have more and more access to technology within healthcare, that really shifts things. And it's a bit of a game changer because you see the ability to do things like remote care monitoring, which again allows us to deliver care within the home. So now your caller was talking about within a pandemic, how this all of a sudden, really sort of the spotlight is on these acute care beds because we really need these acute care beds to treat our patients that are affected by COVID-19. And so what you're really seeing in wave one was where we were canceling surgeries and doing things that had, of course, negative consequences to those affected to try to reserve that capacity for those that were infected by the virus. With wave two, what you're seeing is us doing everything that we can really to maintain that access to care. So much so that you have task forces in Ontario, for example, one that I sit on, where we're looking at, how do we look at all of these hospitals as one system and ensure that our patients have equity in terms of access to care so that we can maintain scheduled care within the hospital? And how do we create like a fortress, a moat around long-term care in our vulnerable populations to keep them safe so that we're not then flooding the hospital system and can keep our scheduled care ongoing? So really that's what we're trying to do, to use these acute care beds.
Dr. Nimji, thanks very much.
And it's just interesting to think of Bill's question. I mean, it's tempting, I think, as Canadians to compare ourselves to the United States.
It's hard.
But also, I mean, keeping in mind that the bar can be set higher, right? And it's probably important to remember that. Just speaking of reminders, hello to our Zoom audience. Very good of you to join us. I know we're on a delay, so even if I wave, my feelings won't be hurt if you don't wave back.
You'll get over it.
But a reminder, of course, that if folks across the country have questions for us, including our virtual audience here on the wall behind me, they can send their questions in to us, covid@cbc.ca, or if you're joining us via Zoom, just type in the chat, and we'll try to get as many of those questions on the air as we can. Let's go to a video question, though, from Daniel in Kingston.
Now that Toronto and Peel regions are under major shopping restrictions and the holidays are quickly approaching, I'm sure that some people are going to leave their areas in order to do shopping in other places, like Kingston. This is something that the government and the Ministry of Health really need to think about. Toronto is only a 3-hour drive to Kingston, and Ottawa is only 2. Both areas are red zones. There's nothing in place to stop people from traveling to other communities within Ontario. In essence, going to places that are still open for business.
So that's a really interesting question. Dr. Sinha, is that a big concern in your mind?
It's a huge concern, and I think Daniel's raising the fact that, people can just drive a few hours and go to another city, because while we've made recommendations saying that if you're in a lockdown zone, you shouldn't be shopping, you should be socializing only with your own family, yet we're next door. The GTA is a big area, and I can just go 40 minutes north of where I live and go shopping all I want. So that's the challenge, because what we're also seeing is that we're actually spreading the virus when we're not staying put and doing what we're supposed to be doing. So these are risks, and this really talks about policy that's actually linked with clear recommendations that if you're in lockdown, you shouldn't be shopping in another region.
Yeah, and Adrienne, I know I remember early on in the pandemic, and it's probably still true now, that advice of you kind of almost have to assume everyone is infected and protect yourself.
And it's so hard to keep up that vigilance, which is why I think people, we've heard it so often already tonight, people are just so tired. So we're going to try something here. We're going to go live to Donna and Bruce Bose, who are, there they are, joining us from Lansdowne. You look fantastic. Thank you for joining us. I say you look fantastic because I gather you both had COVID earlier. Can you give us a rough sense of what that was like for you?
Yes, I could give an overview. It was the very beginning of the COVID process. Back in March, we traveled to Mallorca, Spain on an organized tour. And we were there about a week when the Spanish government shut down the country. And Canada was saying all travelers have to get back. So we ended up buying tickets and flew back home. And about a week later, I started to develop some severe breathing problems, which led to an ambulance ride to Kingston General Hospital and cytokine storm a ICU visit where they intubated me, put me on a ventilator for about 4 days, and I was in the hospital about 10 days. And meanwhile, back at the ranch, Donna developed COVID. So maybe you can just say what you did.
About the third day in, after Chris went to the hospital, I started developing the no taste, no smell. I had a backache and extreme fatigue. I was being monitored every day by public health. So I had a public health nurse contacting me each day to see how I was managing because, of course, I was quarantined. My symptoms lasted probably 10 days, I would say, until I started to get my taste and smell back again. But by mid-April, we were both clear and feeling good, perfectly healthy.
Well, you look fantastic. And I know you have a question ready, so have at it. This one is for Dr. Bogosh.
So as COVID survivors, presumably we already have immunity. Therefore, do we need to take a vaccine?
Dr. Bogosh?
That's a great question. Yeah, terrific question. So short answer, yes, you do. Longer answer, we know that people who have recovered from a COVID-19 infection, such as the two of you probably have some degree of immunity for some period of time. It's not quite clear how much immunity and for how much time. We certainly know that there's several credible cases of people who had COVID-19 who were reinfected. The number of credible cases is probably dwarfed by the number of actual cases. So we're probably only seeing the tip of the iceberg. And certainly by having the infection, you probably have some degree of immunity, but it's just not clear for how long. So I think it's very likely that the recommendation is going to be for everybody to get this vaccine, including people who were previously infected with the virus.
Okay, good answer, Dr. Bogosh. Just so people know, you're not a ventriloquist. We can hear you. We just cannot see your lips moving. COVID technology, we'll get it sorted out. But Donna and Bruce, thank you very much. We are going to another question from a young person who has been really paying attention to this.
My name is Krishna Wali. I'm 11 years old from Brampton, Ontario. And I would like to know, since the flu shot has been proven to not work on everyone, how can we be sure that the COVID vaccine will work?
Okay. Grishma is asking the question that everybody in the country is asking. Dr. Chagla, not to put you on the spot, but what's the answer?
Yeah. So first of all, the flu shot works, and I really want to make that certain. The flu shot does incredible work at bringing down our rates of community influenza, at preventing disease, or at least modifying disease. The design for these new vaccines for COVID-19 are very different than the flu shot. So they use proteins, they use the molecular structure of the virus to generate proteins internally, and again, from what we know, we at least know people make really good immune responses and maintain them for some time. And then the press releases we've been seeing over the last 4 weeks between AstraZeneca, Pfizer, and Moderna, that it actually prevents people from getting COVID-19. And these are real people. These are also people of all ages, different ethnicities, and even some elderly individuals. And really a little bit of a signal there that it even prevents, even if you do get COVID-19, it may actually prevent people from getting severe disease. So we don't know all the answers to these vaccines, but I think the information out here is good enough that we need to start trying them out in people, knowing that we really don't have any other interventions out there. It's important we start getting these to the table, and I think we're going to be pleasantly surprised at how effective they are given what's coming out of our clinical trials.
Okay, excellent. Good answer and good question.
Can I? I feel like I have to ask a question on Grishma's behalf and of my kids' behalf. Dr. Chagla, and we may not know the answer. Do we know if the COVID vaccine will hurt more than the flu vaccine or any other vaccine?
Yeah, I mean, it is a good question. And the side effect profile seems, this is a vaccine that really gets a really robust immune response, which unfortunately means that the place where it goes in gets the first immune response to it, and that people who have gotten the vaccine have certainly gotten injection site pain, a day of fever, feeling a bit off. That is actually a good sign. That's the vaccine actually working. It's triggering your immune response like it should. But yes, it might be a little bit more painful and a little bit more, off for a day than the typical influenza.
I'm sorry, I had to ask.
We might not have needed that information, though. Thank you.
Okay, we're going to take a short break here, but we do have many more questions and answers coming up.
But first, there is something reassuring about knowing we're all living through the same moment in history. But depending on where you are from, what you do, and who you are, we're experiencing the pandemic in very different ways. So we have asked Canadians from across the country to share their experiences in Pandemic Diaries. Here's Jennifer.
My name is Jennifer Lau.
Okay, driving through your heels, you're gonna stand nice and tall.
I'm the co-owner of Fit Squad Toronto, which is a boutique fitness facility located in downtown Toronto. Mentally and physically, the pandemic's been tough. I lost my grandfather very early on during the pandemic. When he fell ill and was admitted to the hospital, I wasn't able to see him, wasn't able to say goodbye. The same day that we buried my grandfather was the day that I launched the Safe Health and Wellness Coalition. It was a response to several small business owners in the health and wellness sector sharing their concerns, fears, and worries about what this would mean for their business. It's been quite a supportive and rewarding experience, and I'm optimistic that things will change.
We need to survive.
That's what keeps me going.
Welcome back to Confronting COVID, our national virtual town hall.
Yeah, tonight is all about you, your questions about your health, your community, your future. And when we talk about future, we are talking about a vaccine. So let's get into that topic because, boy, do you have questions.
Canada has direct agreements with a range of vaccine developers.
With those purchase orders and plans to acquire hundreds of millions more doses, Ottawa is spreading its money across the field to ensure supply. So that means working with pharma giants in the US, Europe, and here at home. So far, the American products show the most promise, with the Pfizer and Moderna vaccines proving 90% and 95% effective, respectively, in phase 3 trials. Health Canada must sign off first, but it could approve the Pfizer vaccine for use in just a matter of weeks.
And so we've got a question that we've got up here on the big board. And Dr. Bogosh, I think this is a good one for you. And it's a question that bears asking again and again. Does the virus mutate? If so, how will that impact vaccine efficacy? And this is coming to us from the Zoom audience just behind me. So this is live to you, Dr. Bogosh.
That's a great question. And certainly the virus does mutate, and we can track that. We've seen these mutations, and we basically use the genetic fingerprint and how it changes over time to help track the spread of this infection and sort of piece together how it spreads and where it started and where it's at now. Now, certainly it's theoretically possible that those mutations could impact the vaccine and how the vaccine works. And in fact, most of the vaccines target a very specific part of the virus. So if there's a mutation in that part of the virus, yeah, we certainly could see some issues with vaccination. The thing is, it doesn't appear to have happened yet in the clinical trials. We clearly see that these vaccines are very, well, they seem to be working and they're rather effective. But could that theoretically happen? Yeah, absolutely. In which case we might have a bit of an arms race, developing a vaccine to stay ahead of the virus, to build another vaccine to stay ahead of the virus, much like we do with influenza. But that hasn't happened yet. And fortunately, we have some vaccines that are, quite frankly, on the near horizon.
Right. And Dr. Bogosh, I mean, that's such an interesting last point there. Adrienne, I mean, when we think about how we have to stay alive to the possibility that it may not just be a one and done sort of vaccine, right? Influenza we get year after year after year.
I mean, scientifically, absolutely. I think psychologically, that's a little tough to accept. But I also think, listening to these questions, that the whole planet's getting a fantastic science education right now. I'm willing to bet more people will sign up for med school after this. So speaking of people who have very specific questions, we're going to go to Frida in Toronto.
Hi, my name is Frida, and my question is, we know there are two companies in the lead for a COVID-19 vaccine, Pfizer and Moderna, and they are using an RNA vaccine which has never been used before. How do we know what the long-term effects of this vaccine will be on people who take it, and how do we mandate a vaccine that has not been studied for long-term effects yet?
Dr. Martin, I see you nodding here. I know you have thoughts. What's your answer to that one?
Well, you know, this is hard because there are, of course, no one can make a guarantee about the long-term effects of any new drug, device, or in this case, vaccine. But having said that, you know, the data so far coming out on these vaccines is that they appear to be very safe. And we do know a lot about how vaccines work in general, and some of that knowledge can be extrapolated. The other thing I'd like to say is that I think it's important for all of us to remember that we're not weighing the risk of the vaccine against no risk at all. We're weighing the risk of the vaccine against the risk of contracting COVID. And we do know that there can be very long-term and very serious effects from getting COVID-19. For those of us, you know, who are not at risk, we may or may not be at risk of dying from COVID-19, but certainly we are learning more and more about the potential long-term health effects. People can develop cardiac disease and all kinds of other, you know, the so-called long hauler syndrome, et cetera. And so there are long-term impacts for sure for many people who contract the virus. And we're always in life, as in medicine, we are always weighing risks against risks. And so should the vaccines prove to be, as we think they are, highly effective and very safe, I can say that I will be getting mine as soon as I am allowed to do so.
All right, Dr. Martin, thanks very much. The questions and concerns about vaccines range from sort of the theoretical to the practical. We have a question now from someone you'll probably recognize, our former Governor General.
Hi, I'm Adrienne Clarkson. You know, I grew up as a child during the polio epidemics and the horror of not being able to go to a movie or to a public beach or a swimming pool for all the summers of my childhood, basically. We were so terrified we'd get polio and become paralyzed. When we get vaccinated, what is actually going to happen? Will we get 1 or 2 shots? And then how long will it be before we have what's called herd immunity?
Okay, Dr. Chagla, very practical, but very common question there.
Yeah, I mean, first of all, it's an honor to be answering a question from a former Governor General. You know, she first raises a really, really valid point here, is that, you know, we talk about vaccines, we have hesitation, but polio is a disease of no concern in Canada anymore, and it is solely due to vaccination. There are so many diseases that are not endemic to our country, and it is solely due to vaccination. And I think it's just so profound hearing a message from an era where there was a vaccine preventable disease that has turned into an eradicated disease in the Western world. Talking about the second part, in terms of the dosing regimens, the Moderna, Pfizer, and AstraZeneca vaccines do require a second dose approximately a month apart. These vaccines will trigger an immune response, either by your body generating the proteins, or in the AstraZeneca vaccine, the viral vector then showing off the components to then generate the proteins, and a similar response after that. I'm not sure how long it will take to get herd immunity. You do need a significant amount of the population that's immunized. And I think the big question is these vaccines have been trialed in relatively healthy populations, even though they varied by age and ethnicity. Once you actually get out to the communities, you get to people that are more medically complex, that have cancers, that have transplants, that are, you know, in long-term care facilities. How much of that is going to translate over into the overall effectiveness of these vaccines? And that's really what's going to determine how long it takes to get true herd immunity in that setting.
Okay, thank you very much. That's a solid answer to a solid question.
I will say, I like how she introduced herself by saying, "Hi, I'm Adrienne Clarkson." I don't feel like a former Governor General should have to introduce themselves to Canadians. Dr. Chang, we've got another excellent question from our live Zoom audience, and I think this one's for you. What challenges do you see in getting people vaccinated, and how do we overcome them? That's a toughie.
Right. Yes. So, this is the unknown. We have never been here before as a nation to vaccinate so many people on a schedule, but we also look at how well Canada did in this pandemic, and we can use that same mindset. Human beings, we are resilient, we are problem solvers. And yes, there will be challenges, distribution challenges, and how people will get vaccinated. But when you look at what our schools have done, what our frontline workers have done, what our military can do and will do, I'm very confident that Canada will be able to overcome all of those challenges. And yes, there will be them, but we can work together and solve this problem. We are innovators as well.
All right. Shelley Simmons, thank you so much for that question. And Dr. Chang, thank you so much for that answer. We've got another one. This is from Emily in Montreal.
My question is, once most of the population gets vaccinated, what needs to happen before we can stop social distancing and mask wearing? Thank you. Stay safe.
No, thank you, Emily. Dr. Nimji, this one's for you. What do you think? When can we throw away the masks?
When can we throw away the mask? That's the million-dollar question, right? So I think when we talk about vaccinating, really, we've heard a lot about how there's going to be sort of a stepwise process here, a methodology behind that, making sure that those that are most vulnerable or most at risk are vaccinated first, most likely, as well as the healthcare workers that serve that population to keep those people safe, and then slowly sort of spreading and scale that delivery of the vaccine. So what I think you're going to see is, again, in parallel, a sort of a drawing or pulling back of some of the measures that we've been using to keep the public safe. So it's not going to be a sort of, now we can all take off our masks. I think you're going to see it happening in given spaces and then slowly coming down. The other thing we look at is with any given vaccine, we look at the infectivity of the pathogen, in this case, COVID, and how effective the vaccine is. And we have a sort of sense of how much of the population really needs to be vaccinated for us to sort of feel confident in the level of immunity in the population. That will also weigh into that decision of when we can really sort of pull back the last of the measures that we have.
Right, yeah, so very gradual progress, but a gradual drawback, as you've said. Dr. Nimji, thank you so much.
Yeah.
It's been really difficult to not only focus during the 3 hours, but also just process everything.
Like a little bit quieter in the halls, less crowdiness, so it feels a little bit safer, maybe.
Safer? Not really. I'm still in school next to like 200 other people. There's nothing safe about it.
Okay, just a few perspectives from Canadian students juggling classes during COVID-19. So while schools are not the biggest sources of transmission, there are some real dangers. How to handle school is going to remain a big challenge in the new year, and that is what we want to explore now. So when we're talking about schools, let's go right to a question that we have on video from Rudolph.
Hi, my name is Rudolph Fuhr. I am 52 years old, a high school teacher with a pre-existing condition, namely heart disease. I've been advised not to re-enter the classroom until I have been vaccinated. My question is, should I expect to be one of the first groups of people to get the COVID-19 vaccine?
Okay, so Dr. Chagla, this has got to be terrifying, right, to be a teacher. It's a solid question Rudolph is asking. Should he expect that, to be one of the first?
Yeah, it's a really good question. This is one that's really being foundationally developed today across the world. We've been hearing more and more about different countries' strategies. The NACI, which is our National Immunization Organization, has put out a framework really defining the priority groups for this. I think they've focused on the most vulnerable individuals, and I think all of us can agree that the individuals in long-term care have suffered the highest brunt of disease and death within the pandemic. healthcare providers around them, as well as then those vulnerable populations and other healthcare providers to really round out that circle of people that are at risk, but also people that need to provide care to those with COVID-19. And so I would expect Rudolph to be within that group, recognizing then after that, we start talking even then about front-facing other professions like teachers, police officers, firefighters,
Right.
even if they don't have underlying conditions, knowing they have to face the public. So yeah, I would expect Rudolph to certainly be up there in the prioritization scheme. It may not be completely number one, but certainly that's the big population to get out to relatively quickly in that first burst of vaccines.
Okay, so that's going to be good news for Rudolph. Thank you, Doctor. Staying with schools and the matter of how this works for kids and teachers, let's now go to Natalia from Sarnia.
We all know closing schools impacts students the most, but it also directly affects our communities and the economy. To create a safer learning and teaching environment, do you believe teachers and education workers should be considered as a priority for receiving the vaccination? Also, when the vaccination becomes readily available to all Canadians, do you believe it will be a mandatory immunization for all students to attend face-to-face school?
Okay, so Dr. Sinha, to you, the last part of that question is particularly interesting about a mandatory vaccination program for face-to-face school.
Yeah, no, I mean, we just talked about the prioritization sequence, and we're really focusing on those who are at greatest risk right now across the country. And so again, focusing on seniors, those particularly in long-term care, frontline health workers. But of course, there's a lot of anxiety for parents and for children who are in schools and parents of those and their teachers, because again, you're coming in close contact with one another, and there's a fear that this is a route that COVID can be transmitted. So right now, while it's not at the number one sequence for vaccination, the question is, down the road, as we start having more people wanting to return to school and schools being more crowded again, will we actually mandate? Right now, the government hasn't actually come out and said we are requiring that every Canadian get vaccinated, that we're requiring that you need a vaccination to go to school or to travel, to do those sorts of things. But those might be levers. In some cases, there are some school boards, for example, that say if your children aren't vaccinated, they can't come to school, or you have to show us that you've considered that choice as well. So there haven't been any decisions. And I think the goal right now is to make sure that we educate ourselves, that we make sure that we know the information about these vaccinations, we get people access to them, and hopefully we won't need to do a mandate, but we can actually just make sure that we choose to get vaccinated.
All right, Dr. Sinha, thank you. It's interesting, Andrew, listening to this. It sort of hammers home that there's a long road ahead, a lot of really difficult decisions yet to be made.
Yeah, and as Dr. Sinha points out, I mean, here in Ontario and in New Brunswick, I believe, too, immunization for certain vaccines, I mean, it is required, right, to attend school. I mean, my kids had to get polio, rubella, meningitis.
Measles.
Yeah, not flu, maybe COVID, right? I mean, who knows how it'll play out, but it's definitely a smart question. Okay, this is super exciting. Not that everything else isn't also super exciting, but we have joining us right now, Cottrell Sparks from Nova Scotia. Hello, Cottrell. How you doing? How old are you?
9.
9 years old. Okay, I hear you're a pretty good surfer, which I think, funny enough, is a good skill to have with as many ups and downs as we have had. Can you tell me how have you been keeping busy during this COVID-19 pandemic?
I don't know, playing with my little brother. He's 19 months old.
Wow. And has this been a tough time, being in the pandemic?
I mean, not for me.
Because you've got a little brother to take care of, so clearly you're keeping busy. I understand you have a question for our doctors, and I'm going to ask Dr. Nimji and Dr. Chang maybe to tag team this one. What's your question?
Is the vaccine safe to use?
Well, hey, that's a good question. Dr. Nimji, why don't you field that one first?
Sure. So we heard from some of our other colleagues talking about the vaccine. And so the vaccine in this trial was tested on a whole lot of people with a whole bunch of different characteristics to give us some indication across a wide number of people how safe or how effective this vaccine is. And we know that most of the side effects that people had were pretty mild. We talked a little bit about, your arm hurting or feeling kind of crummy or having a bit of a fever the following day. Which some people have sort of similar experience with a flu vaccine. So we've talked about some of those side effects. And so we believe this to be an incredibly safe vaccine, not ready for children as young as yourself, but our hope is that we will get to that point.
And Cottrell, are you going to school right now?
Yes.
And I'm very curious to know how you feel about that. And I don't know if you have any questions about it.
I have one more question.
Yeah, go for it.
Should children be scared to go to school at this type of time in the pandemic?
Dr. Chang.
Right. Well, I want to say thank you, Cottrell, for your question. You're very brave. And you may not know this, but playing with your little brother during this pandemic, especially the last 9 months, has helped grow his brain, right? Because babies need to see each other and look at our faces. And that's been such good activity for you and your brother to play. And we need more of that. When we think about fear, Cottrell, we really want to try not to be scared. You want to be careful. You want to do all the right things, socially distance, wear your mask, wash your hands. But we don't want to be fearful or scared. That actually releases something called cortisol. It reduces our immune system and actually makes it harder to solve problems. So, take a few deep breaths, keep that mind positive. We are getting through this and things will change for the better, and stay brave because you're doing a great job.
Cottrell, are you really good at washing your hands and wearing your mask?
Mm-hmm.
Okay, excellent. And I hope you can hit the surf real soon. Cottrell Sparks in Nova Scotia, thank you so much for joining us. What a pleasure to talk.
He's amazing.
Yeah.
You're amazing, Cottrell. So stay with us. We have many more questions on the other side of this break.
Yeah, we'll be right back. Welcome back. COVID-19 has presented Canada with many challenges, and worldwide, just about everybody's struggling.
So some countries are doing better than we are, others much worse. Let's take a look at how Canada fares in a global context. Considering it belongs to the worst affected region, Canada is holding its own. Its infection rate several times lower than the U.S., which is by far the hardest hit country on earth. Dozens of other countries have also recorded more total cases than Canada. But by another metric, this country is doing less well. Yes, Canada has lost far fewer people overall, but the case mortality rate is considerably higher than the United States, and it's over twice as high as Germany. Then there's the age factor. Of the roughly 12,000 Canadian deaths, over 95% were people 60 and older, the overwhelming majority of them connected to long-term care homes. Even so, roughly 400 people were either young or middle-aged. That's concerning, especially as infection rates in those groups goes up. And so there is a lot to think about here. We've talked about schools, we've talked about vaccines, but there's a lot going on internally dealing with the grief and the emotion of this. And so for that, let's go to Vancouver and a question from Zara.
Hi, my name is Zara. I'm from Vancouver, British Columbia. My question is, when family members are hospitalized due to acute illness or family members who are dying in hospital, families cannot be together. This can have a devastating impact that's long-lasting. What are the plans to help mitigate this and to support families being together during such a difficult time?
So Zara, that is that's an astute but also a bit of a wrenching question. So I'd like to go to Dr. Nimji and Dr. Martin, because I know, Dr. Nimji, you've been at the sharp end of watching grief like that and watching people separated. Can you help her out here?
Yeah, Zara, thank you for this question. And you're absolutely right. I think you used the word devastating, which it can be. And so, what I can tell you is that we are really trying to do our best to sort of balance compassion and the need for human connection at times like the ones you just described, with decreasing risk. So, keeping patients safe as well as the families that come to visit their loved ones safe. So, in the situation where somebody is imminently dying, we do absolutely, under compassionate grounds, allow for family to be together as much as we are able. And outside of that, try to do, using, video chats and phone calls, but also us trying to really be there as a go-between to let you know how your family's doing and relay those messages, and to be as caring and compassionate as you would want to be in that situation on your behalf. But we're really trying to balance those things, and very much are aware and appreciate how difficult it is for families.
So that is really hard, obviously not just for families and patients, but for all the medical staff who have to do that. Dr. Martin, is there anything that can be done to help people? Any other good ideas out there?
I mean, so many ripples of grief, right, as a result of people missing those critical moments together. And it's not just sad moments like the death of a loved one or funerals, but also happy moments, births and celebrations, so much that everyone is having to sacrifice during this time. I would say that on the hospital front, I think we're learning and getting better as a healthcare system at trying to understand, the true difference between a visitor and an essential caregiver who, in many cases, actually, essential caregivers can be critical members of the care team. We've always known that, for example, about the parents of children who are admitted to the hospital, and we're learning more and more how to balance those risks with other family members and caregivers as well. And there isn't an easy answer to this one, just as there's no easy answer to all of the other sacrifices and types of grief that all of us are experiencing as a result of this pandemic.
Okay, thank you very much. A big part of this conversation has been that we talk often about people, but sometimes we don't hear enough from the people we're talking about. So this is why we want to go to Regina. We want to go to Chelsea, who's living in a long-term care home. Chelsea?
Hi, my name is Chelsea Jura. I'm 32 years old and I live in Wascana Rehab. With the COVID restrictions, silence is becoming deafening and the isolation is consuming. And a lot of people, myself included, feel like our voices aren't really being heard. What can be done to ensure that my voice and the voice of others living in long-term care facilities matters?
So Chelsea's voice absolutely matters. We hear her, but within that, it's very clear. This is an urgent problem, Dr. Sinha. She's right. Like, what can be done to make sure people are being heard?
Chelsea's absolutely right. She represents one of the 250,000 Canadians who are currently living in our long-term care homes, and they've really seen, and unfortunately, many have suffered a lot. So one of the things that actually is being done across the country is, in some places like Ontario, we actually have it in legislation and supported that we actually fund the creation of resident councils, but also family councils, so family members can get together and be supported to do so, as can residents, so that they can come together, they can talk about the things that matter to them. They have a mechanism that they can raise their voices to the home to make sure that their considerations are being made. And in other parts of the country where those mechanisms might not exist, there's nothing stopping Chelsea from getting together with her colleagues, her other residents, for example, or families to get together to raise their voices and to be able to speak to the home if they feel that their voices aren't being heard, and by reaching out in ways like this. So I really thank Chelsea for raising her voice, because these are the voices that need to be heard, especially when there's been so much suffering in our long-term care homes.
Yeah, absolutely, really important. And I've heard people talk about COVID as an accelerator, in that it cuts through the bureaucracy, that good ideas can just happen.
Right.
This sounds like one of those good ideas.
And there's more to talk about. And I should say that I love that we can count on our live Zoom audience to be feeding us questions throughout this entire program because they have not let us down. This is no exception. And Dr. Sinha, I want you to answer this one if you could. So the question is from Arthur. We just learned there are 49 positive cases in my mom's home. Is it safe to visit if we wear full PPE? What do you think?
No, it's a great question. And again, this is a family's worst nightmare. You're worried about your loved one, and then you find out there's an outbreak in a number of cases. And Arthur might just be one of those, what we call family caregivers, who's been visiting regularly to provide his loved one care and support. And so we wrote some guidance through the National Institute on Aging with a lot of experts, some on the call tonight, that really help to emphasize that even in an outbreak situation, we should allow family caregivers to go into a home, but obviously with the right training, making sure that you know how to practice good hand hygiene, infection prevention and control measures, wearing the appropriate PPE. And so in Ontario and other regions that have adopted this guidance, they are allowing family members to go in, even during an outbreak, and provide care. But what we always want to do is make sure that we don't have more cases of COVID by making sure that they're safe in the care they're providing.
Yeah, no, and it's such a tricky balance, right? But thank you for that answer. We've got another question here. This is from Samson Cree Nation in Alberta.
Hello, my name is Kaya Bruno, and I am 15 years old from Samson Cree Nation in Massachusetts, Alberta. And one of the questions I have in regards to COVID-19 is about mental health and addictions in our First Nations communities. What more is being done to support the crisis when lives are on the line more than ever due to COVID?
And so, Dr. Chang, this one's for you. And we don't have a lot of time, but it's an important question. Oh, actually, okay, I understand, Dr. Chang can't quite hear us. Dr. Martin, maybe I'll have you field this one. I mean, it is a messy confluence, right? Where you have COVID, mental health, addiction, all of these things swirling around, and all can be related.
That's right. And of course, we know there's evidence not just from Canada, but elsewhere in the world that mental health is at risk in times of a pandemic crisis like this one, and also specific evidence around our Indigenous communities in Canada and people who've been separated from their nations, who are not able to travel home, who've been further isolated. And so lots and lots of considerations and information about increased rates of opioid deaths among some communities, et cetera. So it's really difficult and complex. I will say that one of those instances of being able to cut through the bureaucracy and do better more quickly than we have in the past is around the provision of basic mental health services across the country, including access to internet-based mental health supports provided by non-physicians, telephone-based counseling, online counseling. These are things that many of us have been advocating for years in order to get better access to people on the ground. And sometimes a phone call at a critical moment can help. I'm not saying it solves everything, but certainly I think we're all aware, and our governments are aware, that there is a pressing need to support people's mental health. And the longer this drags on, the more critical that need is going to be.
Yeah, no, so many important points that you just made there. And Adrienne, I mean, there are other reasons for optimism too, right? That occur to me when I think about vaccine development, for example. You think of the AstraZeneca vaccine. One of the remarkable things about it is how much easier it is to store. The refrigeration requirement is so much lower. That can be useful in remote communities.
Well, it will have to be, right?
Yeah.
Because the logistics of this are going to be really difficult. They need every angle they can get.
Yeah, no doubt. Okay, don't go anywhere. We are about to, this camera. We're about to start hour 2 of Confronting COVID, the national virtual town hall. And first up, we have a look at the day's news.
And remember, we want to hear from you. So send us your questions to covid@cbc.ca. We will put as many as we can to our doctors. Hour 2 of Confronting COVID, a special edition of The National, starts now. Good evening, I'm Adrienne Arsenault.
And I'm Andrew Chang. More heartache today from a relentless pandemic. It can be hard to stand back and just catch a breath.
But we need to do that tonight. So let's look at COVID-19 in Canada and why there's reason for hope. This is a special edition of The National.
Right now, millions of Canadians are locked down with a lot to think about. COVID-19 has exposed some hard truths, and over 8 months later, we all feel it.
It is hard to turn on the news, to get up for work if we still have work, or face the lineups at the store. This is like wearing a backpack full of bricks every day.
And yet, as 2020 winds down and the holidays approach, we persevere. The economy, government, and hospitals are functioning. But with vaccines on the horizon, we can't let our guard down.
This is a choice. Give in to fatigue or stay vigilant and beat it together. Confronting COVID. Welcome. And as you can see, we're doing things a little differently tonight, including a virtual audience for this special town hall. After some news, we're going to throw things over to them and to you.
Yeah, that's right. Tonight is largely about your pandemic questions, and here are doctors on call to answer them on so many subjects, from vaccines to schools to what to do about the holidays.
But let's start with today's top COVID-19 story. So we often think of hospitals as occupying the front line.
But in a lot of ways, they're really the last line of defense. And tonight, they are under siege. Ontario and Quebec may lead the country in total COVID patients, but their populations and healthcare systems are large too. Hospitalizations per capita reveal where the pressure is highest. And Manitoba doctors have long warned of a crisis. This is why. The rest of the country, including BC, doesn't even come close.
But the other thing to remember, it's crucial, is that ultimately this all comes down to the patients the doctors cannot save. And BC is seeing some of Canada's highest per capita daily death tolls. Briar Stewart shows us an especially vulnerable group.
Outside of the Tabor Care Home, a show of support for those inside, from care home workers who've been through their own deadly outbreaks.
We know what they're going through. We know how hard they're working and how exhausted they are.
147 residents and staff have tested positive for COVID at this home. 19 of those living here have died. It's the largest outbreak in the province, but far from the only one. There are outbreaks in nearly 60 care facilities in BC, including the home where Lynanne Beck's mom lives.
That was her 100th birthday party last May.
She hasn't been able to see her since the beginning of October.
I don't really know who brought the COVID into even the place where my mother is. Like, was it the staff or was it the resident? Because who's doing the tracking? And we're never told that.
As the outbreaks grow, there's frustration from families who believe their visit should be deemed essential.
My mom has lost 20 pounds and she's lost her mobility because they simply say they do not have the time or the staff to help her use her walker. If that's not essential, I don't know what is. Agility.
Brenda Howard also wants to see more testing of staff, but health officials have said they aren't sure how helpful that would be.
I don't see why, if it's good enough for the NHL, it's not good enough for us to have rapid testing. Test our staff.
The province has committed to hiring thousands of more care workers, but right now, many are facing burnout.
Because we've confined workers to single sites earlier in the spring in BC, that means our casual lists are drying up and we can't get the backup we need to help care for these seniors.
Officials say the real problem is that the virus is spreading so widely in the community that it's bound to make its way into care homes and infect some of the most vulnerable. Briar Stewart, CBC News, Vancouver.
Manitoba is also facing its deadliest days of the pandemic so far. Today, 16 deaths, a new record.
And this is a tragedy for all Manitobans. And so we know that these are much more than numbers.
Manitoba's top doctor added that the province's 283 cases today is too high a rate for the healthcare system to sustain. The premier today said the province handed out 100 tickets totaling $180,000 in fines over the past week to people accused of breaking public health rules.
The Prime Minister spoke today about Canada's plan to roll out a COVID vaccine.
as we approve vaccines, we will be able to roll them out to Canadians, and we're working to do that, like everyone is around the world, as quickly as possible while remaining safe.
So we know that Health Canada is currently looking at 4 vaccines. That's Pfizer, Moderna, AstraZeneca, and most recently, Johnson & Johnson. The federal government has secured hundreds of millions of doses.
We are putting all of the pieces of the puzzle in place now, including having discussions with the provinces and territories who will be responsible for rolling out the vaccines in their respective jurisdictions.
And the minister says vaccines are expected to arrive early next year. Some news today for people suffering chronic COVID symptoms long after they stop testing positive. They are known as long haulers. And Christine Birak tells us what researchers think they've learned about them.
Before having COVID, Simone Gavros was regularly hiking, dancing, and exercising. But 7 months after a mild infection, she can't do those things.
Last Sunday, for example, I was vacuuming and I was so out of breath. I had to pause, breathe, and then that exhausted me for the entire day.
While the vast majority of people with a mild case of COVID-19 recover within 2 weeks, recent studies estimate at least 10% are experiencing long or chronic symptoms. Doctors studying those patients now say they might know why.
We think that there may be an autonomic dysregulation in some of these patients.
Autonomic dysregulation means there's an imbalance. The body stops automatically regulating things like heart rate and blood pressure.
Because of the COVID infection, it may not work the same way as it usually does.
European researchers note long COVID symptoms, including fatigue, brain fog, and heart palpitations, resemble a common blood circulation disorder called POTS. Triggered by viruses, POTS is an abnormal increase in heart rate when a person moves from a reclining to a sitting or standing position. Gravity pulls their blood down to the lower half of their body, away from their heart and brain. POTS is treatable, but there's no cure.
Okay, so everything is going smoothly here?
Doctors caution a lot of research about chronic COVID still needs to be done, but add it's taking a heavier than expected toll on otherwise healthy people.
We're hoping that at least by a year out, some of these deficiencies will have resolved, but I don't think they'll all have resolved, unfortunately.
I'm definitely scared that this is going to be a forever thing, and I guess only time will tell.
Gavros hopes her body is just recovering, but thousands of Canadians could find themselves in the same situation. Christine Birak, CBC News, Aurora, Ontario.
Now, I want to bring in emergency physician Dr. Taslim Nimji and infectious diseases specialist Dr. Isaac Bogosh. Dr. Nimji, maybe I'll start with you because I'm curious to know what you see firsthand when it comes to these really long, really slow recoveries.
So we don't see a whole lot of them in the emergency department, and I think that's primarily because they're seeking care either through their primary care providers or through specialists. I think the respirologists, rheumatologists, and other subspecialty doctors are going to be telling us more and more over time. But when we do see these people in the emergency department, their primary sort of symptoms that they're endorsing is prolonged shortness of breath or decreased exercise capacity. So getting short of breath with, otherwise sort of regular activities where they would not have been short of breath, really a lot of fatigue. And then there's brain fog. There are people that saying, that I was a lot sharper and I can sense a difference. Others might not see it, but I can feel that I'm not thinking as clearly or that I'm more forgetful. There are some that have some joint complaints, but I would say those are really the sort of the bulk of the symptoms that we're seeing from these people.
And Dr. Bogosh, I can't help but think about when a vaccine finally rounds the corner. Would a vaccine help one of these so-called long haulers, either with their symptoms or help protect them against subsequent infection?
Yeah, a vaccine wouldn't really help with the symptoms. I can't imagine it would do that. But certainly people that have had the infection and cleared the infection are certainly at risk for getting infected again. We certainly have some credible evidence that people have been reinfected. It's not entirely clear to what extent people are immune and for how long they have immunity after they've recovered from this infection. Certainly long haulers, as we're calling them, they certainly have symptoms, but it's not because they have a chronic viral infection that's causing those symptoms. There's residual symptoms, but it's not related to a virus being present in their body. So they're just like everyone else, they might be at risk for reinfection, and certainly a vaccine would be warranted in the vast majority of those individuals.
All right, very good to know. Dr. Nimji, Dr. Bogosh, thank you. And you will be back a little later with the rest of our doctors tonight.
Okay, so let's turn for a moment to the financial side of the pandemic. Canadian banks are beating expectations, in part because insolvencies haven't boomed as feared. Peter Armstrong explains why that silver cloud might have a dark lining.
What a difference a few months makes. Last spring, Amanda Merle was out of work and worried about paying the bills.
Just feeling out of control, panicked, not really knowing what our options were.
COVID was wreaking havoc across the country. The job she was up for was put on hold due to a hiring freeze. Merle and her husband considered a mortgage deferral, but took advantage of record low interest rates instead and refinanced their debt. Then, as the economy reopened, things turned around.
My husband's employer had the opportunity to relocate us to BC.
Both of them ended up with jobs on the other side of the country. Their debt is manageable, life is better. That story, it seems, is more common than many expected. The fear last spring was that the pandemic would combine with Canadians' record level of debt and overwhelm millions of people who just lost their jobs and ability to pay the bills. So the banks allowed for mortgages to be deferred. Interest rates fell to record lows, and federal support programs flooded the country with cash to keep people whole. And for the most part, that tsunami of insolvencies never came. Maybe it just hasn't come yet.
I think the banks are going to look for their pound of flesh.
This consumer insolvency manager has been getting panicked calls for months. He says insolvencies are at an all-time low, but he says a wave is coming.
Ironically, when people get working again, that's when the insolvencies will happen, because you don't need to file when you're not working, because essentially you're creditor-proof.
The economy is still in crisis. Only once it begins to properly recover will we see the extent of the damage and see whether years of record borrowing will finally come home to roost. Peter Armstrong, CBC News, Toronto.
Well, Prime Minister Justin Trudeau is facing backlash for comments he made regarding India's ongoing farmers' protest.
Canada will always be there to defend the right of peaceful protest. We've reached out through multiple means directly to the Indian authorities to highlight our concerns.
His remarks come as tens of thousands of farmers entered the capital city to protest agricultural reforms. Indian politicians quickly denounced Trudeau's comments, calling them ill-informed and unwarranted. Now, when it comes to COVID-19 in India, cases have been declining, but Delhi has had a surge for a week, about 5,000 infections a day, and has more than 500,000 of India's 9 million cases. Salima Shivji shows how the city's air pollution is playing a part.
Daybreak in Delhi, the city already shrouded in haze, gasping for breath. In the middle of Delhi's dense and insistent traffic, volunteers are pleading for drivers to turn off their engines, if only for a few seconds. And anti-smog water guns have also been let loose. The measures aren't all new. India's capital is used to its pollution high season, but the urgency is.
This is the lung of a teenager.
Dr. Arvind Kumar can't hide his frustration. The chest surgeon says Delhi's steep rise in COVID cases is directly linked to its bad air. The respiratory disease latches onto already damaged lungs.
All of us doctors had been crying hoarse that pollution and mixing of people, this combination will lead to higher incidence.
And yet, while some are taking precautions,
basically I have seen some cases within my family, so it's a panic state for me.
Others are not. As the country hits its wedding season, there are few masks in sight in some neighborhoods.
Officials across India are trying to fight that complacency. Some states imposing night curfews, others using roadblocks and quadrupling the fines if you're caught not wearing a mask.
For those donning full protective gear day in and day out, the work is endless. Intensive care beds are full and Delhi's doctors weary.
When you have to refuse some patients whom you can help, it is distressing.
At one of the city's busiest crematoriums, the rituals are now hurried, the goodbyes hasty. Raj Kumar Gupta's father-in-law spent his last days on a ventilator, the family unable to see him.
A huge loss from COVID. People should aware of this and take safety measures.
A message the grief-stricken families gathered here are hoping will sink in. Salima Shivji, CBC News, Delhi.
And a quick footnote to that story. We are pleased to tell you that CBC News plans to open a permanent bureau in India by next spring with Salima as our correspondent.
Very good news. So next, we're going to turn things over to you because tonight is your town hall.
Yeah, a chance to have your concerns heard, your questions about confronting COVID answered.
Suggestions for all the people dealing with this situation of not feeling safe because of the people you have to live with.
How can we help them to understand the severity of COVID-19 better?
I've heard a lot about point of entry testing and exit testing. Which is stronger scientifically?
Which one of these vaccines are we going to ultimately choose?
What advice would you give to those needing support during this holiday season, given the social restrictions of COVID-19?
Great questions. We have a team of doctors standing by, waiting to hear from you. Confronting COVID continues in just 2 minutes.
And welcome back. This is a special edition of The National, a virtual town hall confronting COVID.
Yeah, tonight we are hearing from Canadians across the country live and on video to share their stories and to ask their questions. And we're not the ones setting the agenda here tonight. You are, with the goal here being clarity, guidance, information, and we have doctors on call to give us exactly that. From left to right, starting at the top, going in the bottom right, we've got Dr. Shimi Kang, we've got Dr. Zain Chagla, Dr. Danielle Martin, Dr. Samir Sinha, Dr. Taslim Nimji, and Dr. Isaac Bogosh. Hello to you. And of course, the folks you saw behind me, they're our live Zoom audience. They've got a role to play in all of this as well. They're feeding us questions all through the evening. But let's start with this one. This is from Jenna.
My name is Jenna Evelyn, and I live in St. George, Quebec. I have 2 little kids, both of whom are in daycare. I've been on maternity leave since before the pandemic started, but now I have to go back to work. And one thing I've noticed is that since the pandemic started, the kids are getting sent home a lot more often because of a sniffle and a COVID scare, or because of exposure to someone who had COVID, and so they have to be home quarantined for 14 days. I don't understand how people are able to get work done when they also have to deal with kids being home more often with daycare, and I would love to have some insight on that from the experts.
You know what? I would love to as well, having 2 young kids myself. Dr. Kang, I've followed your work for years. I know you have written and researched extensively that subject of parenting, and boy, these are trying times. So what's your sense of this?
Right, and I need some help too. I have 3 kids as well, and this has been really tough on parents. And I go back to that dolphin firm but flexible metaphor. So have a schedule. That's really important to be firm, but then you have to be flexible. Every day is different, and anything can happen. Guide and lead with empathy. Understand this is really hard on kids. They love school, they need their friends, they need the outdoors, and they have limitations. Try to pick activities and subjects and topics that they like. That really helps. Talk to their teachers and be collaborative, have a pod of support. And optimism. I do have to mention technology because what's happened with the pandemic is technology use has gone up, and in some really concerning ways. Cyberbullying is up with anti-Asian, anti-Indigenous, anti-women. A video game addiction is up, and I ask parents to teach children a metaphor like a diet. There is healthy tech, tech that leads to creativity and learning and connection and self-care. There's junk tech, like a little bit of junk food, a little bit of chips and pizza on a Friday won't kill you. Mindless video gaming, mindless social media, all of us do this. Limit and monitor that, like junk food, and avoid the toxic tech, avoid the hate, avoid the cyberbullying, avoid the comparisons.
Yeah, and those are all such smart points. And Adrienne, I know in our household, increasingly screen time is okay time. And the best words I've ever heard, nobody's perfect in a pandemic. I've never forgotten.
I might be leaning on that a little bit too much, but I like the idea of healthy tech, thinking of it as a diet. I've got a lot of notes here. Part of that was about kids, but it's also about housing. This is a really important thing because, again, not everyone is experiencing this in the same way. So let's go to Francis, who's in Kingston.
I have a question as someone who lives in shared housing because I live in poverty. And I imagine that this is something that many people in shared housing are currently struggling with. I don't feel that I'm on the same page as the other people I live with, and that they're being much less careful and putting my health at risk. And we know that indoor transmission is really sketchy and masks aren't foolproof by any means. So I want to know if it's even possible to socially distance successfully within a household when you're sharing a kitchen and washroom with other people. And there's airflow into your bedroom too, and you can't open windows because it's winter. Or if you otherwise have suggestions for all the people dealing with this situation of not feeling safe because of the people you have to live with.
Okay, so this is a really good question. Sharing bathrooms, sharing hallways, sharing elevators. This is really tough. Dr. Martin, as you listen to Francis there, what can you do to help her?
And of course, we know that although we've been fond of saying that we're all in the same boat, of course, we're not in the same boat. As it's been said, we're all in the same storm, but some of us are in very different boats. And the reality of living in shared housing is it adds another layer of stress. We see this with our patients who are at home living with COVID and in our remote home monitoring programs, and how they struggle to adhere to these rules about self-isolation. Having said that, there are some things, of course, that you can do. The first and most important thing is to remember how critical hand washing is. Hand washing is so important for for preventing the transmission, not just of COVID-19, but of all kinds of other infectious diseases. So frequent hand washing is critical. Trying to keep your distance when you can, and absolutely keeping some air circulation, windows open when it's safe to do that with the weather is also really a good trick. And then trying to keep sort of your own items where it's possible to do so. So your own hand towel in the bathroom that you maybe bring back to your room, your own supplies where it's appropriate and possible to have them. All of those things can help, and as can wearing a mask and asking your roommates or housemates to wear a mask when you're in the same room together, cooking in the same kitchen or in the same living room. And then I think the rest is a negotiation, as it always is, especially around visitors, and trying to ask the people in your shared space to respect that in much of the country we're asking people not to enter households where they don't live. And so if you're living with folks who like to socialize, asking them to do that outside of the shared space is critical.
Yeah, so thank you very much. These are all the fundamentals you're talking about, but boy, the expectations of people now to sort of navigate this socially, it's really hard.
Yeah, and it doesn't have to be a foregone conclusion that just because you share a household that you'll get sick as well. So that's really important tips to keep in mind. You know, we're really lucky to have a live audience watching this program, not just from home, but on Zoom. And they've been so attentive, and they have been contributing so meaningfully to this program because they've been sending us questions throughout this whole town hall. Let's go ahead and put one up on the board. There are only so many walks you can take. Oh boy, yeah, this is true. What are some other cold weather coping strategies? Thank you, Paul, for this. Dr. Chagla, do you want to take this one?
Yeah, so first of all, congregating outside is really based on public health rules, but certainly within your household and in some public health regions with those outside your household. As long as you're adhering to that 2-meter rule, and if not, considering wearing a mask to add on some extra protection, the world is your oyster. We're Canadians. We're used to winter. So tobogganing, skating, snowshoeing, cross-country skiing, having a coffee outdoors with someone, bundle up, but the world is your oyster. I mean, the outdoors is incredibly ventilated. The risk of transmission is 16 times lower. Really, just be creative and yeah, the world is your oyster as long as you're able to adhere to public health precautions and able to distance.
Yeah, and Adrienne, that's certainly something that's become clearer over time, right? The importance of ventilation, being outdoors. My 2 girls very happy to hear what Dr. Chagla just said.
They're getting better mittens for Christmas. Is that what's happening?
Exactly.
All right. Yeah. So let's go now to, we'd like to go to Yellowknife now because Elise has a really important question about her health.
I'm Elise Leggett from Yellowknife. I'm one of the many patients traveling south to Edmonton for cancer treatment. I returned home and isolate for 14 days and have done this since April. I choose to continue my treatment despite the risk of travel and isolation. I have met other people who miss treatment to avoid isolation from family. Given that mental and physical health is dependent on our connection with community and family, what steps would you put in place to shorten our isolation period while protecting the well-being of all of us?
Okay, so this is really important. It's really hard to imagine people who have to make that call to give up treatment, or even as Elise has done, being isolating for 14 days since April all the time. But the core of her question there, Dr. Sinha, about the length of isolation, the 14 days, is that going to change?
Well, it possibly could change in future, but right now the public health guidance is that we ask people to isolate for 14 days. Now, of course, if you've had a positive contact with COVID, the CDC just came out just a few days ago and said, look, we can shorten your quarantine to 10 days, and if you have a negative test, maybe down to 7 days, for example. But right now, in cases like Elise, where she's coming back from treatment, she's about to head into treatment, where they've asked for a 14-day period, or for people traveling to Canada, it's still 14 days. And until the public health guidance changes, we have to kind of do that. Otherwise, we potentially risk not getting treatment as well.
Okay, it's important. It's hard to hear, but it's important. So if we can go to Saskatchewan now and to Dene High School, we're going to talk to Maya because, she has a question that we can all relate to. And again, it's about dealing with people.
Hi, my name is Maya Rowling, and I'm a grade 12 student at Dene High School in La Saskatchewan. Many people in our community have been following social distancing rules and COVID-19 safety measures, but there are still many who believe that COVID-19 is blown out of proportion and not following the rules. My question is, how can we help them to understand the severity of COVID-19 better, as well as what COVID-19 sources can we trust?
Dr. Nimji, how do you have those conversations, as she asks?
Yeah, so I can see that she wants to be a change agent, and that's fantastic. And what I would say is that anytime you have people of differing opinions, the sort of default position we tend to go to first is to say, I just need to keep saying my message over and over to convince the other person. And that rarely works. And that doesn't work in healthcare as a leader, and it doesn't work as a mother, right? So what I would say is that what I've learned is that you got to listen. And so sometimes when you have people that are sort of at two different places in the room, or two different places in that conversation, asking the why questions goes a really long way to try to understand why that other individual maybe isn't wanting to distance, or doesn't want to wear the mask, or wants to go to that gathering that maybe they shouldn't go to, and trying to understand what's motivating those decisions to then sort of open up a space for safe dialogue will get you a lot further. And then I think the second part of that question was around sources of information that you can trust then to try to help in that conversation or that dialogue. So what I would say is, go to the public health agencies, your local, your provincial, federal public health agencies will have lots of information on their websites. If you're looking for something a bit more academic, a lot of the medical journals have sort of opened up their services so that you don't have to pay. You can, look at articles, go to trusted news outlets, go to shows like this one to try to get to the facts, and then use those as conversation starters to see if you can help to sort of bring those people on side a little bit.
Okay, listening, empathy, going to the facts. Thank you very much.
Okay, we're going to take a short break. When we come back, questions about the holidays.
But first, a look at a story we will have for you tomorrow night on The National. Dr. Nimji features prominently in this one. COVID has come for them again. The ICU is full, the ER doesn't stop.
Your COVID test was positive. Do you know that? Yeah. You understand? Yeah.
Just your tank is empty, so you keep trying to muster up some of that energy that you had the first time around, and it's harder this time.
The National checks in with the doctors, nurses, and patients at Humber River Hospital again.
for the hardest and every now and then the best of days. Battling the second wave, tomorrow on The National.
I received a special alert this morning to tell me there is no COVID-19 in the North Pole. Pre-approved travel has been received.
Santa is probably immune from the virus. And of course, elves, they're not humans. They don't have to worry about that at all.
All right, we know that Canadians are trying to keep a little holiday magic despite COVID-19. It's not going to be easy this year. This night is about you, so let's take one of your questions now live. We are going to Ada and Elena Slavinsky in Vancouver. Hey there. Elena, this is The National is usually a news show, so we have some big news for you tonight. Tomorrow's your birthday. How old are you going to be?
I'm going to be 8.
8, excellent. And do you have a sense of how you might celebrate it?
I might be going to the park with my friend Isla.
Okay, excellent. Going to the park together, apart, in the way we do in COVID. We know you've been paying really close attention throughout the pandemic. We appreciate your questions, and you have one for the doctors tonight. Go for it.
Okay, I was gonna ask if, if we're allowed to see, my grandma and grandpa and aunts and uncles for Christmas.
Excellent. Can you see Grandma and Grandpa for Christmas? Dr. Bogosh, this is a tough one.
So first of all, happy upcoming birthday. 8's a great birthday, and I really hope you enjoy the year. Secondly, just like for your birthday, you're going to have a fun time outdoors with your friend, physically distant and separated, but still outside. You could probably do the same thing with your relatives, right? You don't want to get together in an indoor environment with people that you're not close with, because that's the way we can spread COVID-19. But if you're outside and you're spread apart, it's a much, much, much safer way. So I think the first thing to do is really understand what's allowed in the area that you're in, and there might be different rules in different parts of the country. So if you find out what's allowed in your part of the country, that's and abide by it. That's the first step. And then the second step is if you're allowed to get together but outdoors and separated with others, yeah, we know that's a very safe thing to do. So I'd look into doing something more along those lines.
That's fantastic. Elena, did that answer your question? Do you have any other ones?
It answered my question, and I don't have any others.
Okay, perfect. You have an excellent sweater there, by the way. Have a fantastic birthday from us, okay?
Okay, thank you.
Okay.
I have a question. Can we send her some balloons?
Well, of course.
That would be awesome. Okay, right after this, questions about the vaccine and how it'll be distributed across this country.
But first, we've been asking Canadians from across the country to share what they have endured this year. Here is Beth and Ryan from Guelph, Ontario, in their pandemic diary.
Hi, we're Beth and Ryan Waller, and we're realtors here in Guelph, Ontario.
We're hopeful for the future, but what really keeps us up at night is the chance that we could go into another lockdown and having to manage children at home as well as work. Over the past 6 months, the Guelph real estate market has actually been quite strong, as many Toronto area buyers have the flexibility to work from home and their commute isn't as long, and they have realized that they can get more home for their money in Guelph.
As we start to see regions around Guelph go back into lockdown, it's natural to be worried about what's going to happen to the real estate market this time. Will everything come to a screeching halt again like it did back in March and April? Maybe. But what gives us hope is knowing that we've been there before, and if it happens again, we can use some of the strategies we learned last time, and hopefully it'll be a little smoother, and I'll stay out of the cookie cupboard. What?
Welcome back. Welcome to the National Studio, to a special edition of the National Confronting COVID. This is our virtual town hall. Behind us, our amazing virtual audience joining us on Zoom. We are putting their questions to our panel of doctors who have been here patiently with us. You have so many fantastic questions. And this is really good. We need all of them. So let's start with one of them right now. Let's go to Petros, who is in Vancouver.
Hi, my name is Petros and I'm from Vancouver. My question is, which one of these vaccines are we going to ultimately choose, assuming that a number of them are successful that Canada has secured? And also, how long do we think it's going to take for a significant portion of the population to get vaccinated as well?
Okay, this is the bazillion-dollar question, because we keep hearing versions of this. We can't say it often enough, though. Dr. Sinha, what about the timeline here?
Yeah, so the timeline starts with us having Health Canada review the current vaccine candidates that are available. So we know that there's 2 very promising ones right now and a few around the corner. And the key is we want to make sure it's safe before we actually start looking at administering anyone. So hopefully, these 2 that are leading right now will be deemed safe, but we have to wait for that decision. And then it's a matter of the logistics. And we're seeing that we probably, if all goes according to plan, could have vaccines available, within the first few months of 2021, and then that starts the whole process. So how long will it take? It depends on what's approved, and it depends on the logistics of the different vaccines that are available and how soon we can safely vaccinate every Canadian who wants to be vaccinated.
So there is light at the end of the tunnel. I mean, I think that's the bottom line for all of us, is there is some reason to hope, but patience, more patience, right?
Absolutely. And I'm a hopeless optimist, and I think we're all tired. We've been through 8 or 9 months of all of this, and we have probably another 8 or 9 months of a lot more to come. But, I'm hoping that kind of, maybe as soon as the summer or by next fall, we could have kind of a new normal that seems kind of nice. So
that would be great.
Let's keep our fingers crossed.
Okay, thank you.
No such thing as a hopeless optimist. No such thing. I refuse to believe it. Okay, we're going to take you out live to Brampton right now because we've got Shernette McCleggan joining us. Hello to you, Shernette. I understand that you are starting a new job soon as a teacher. Is that right?
That is correct.
Okay, so your COVID world is going to be an interesting place. You've got a question for our doctors.
Yes. So I'm in Brampton, one of the hot spots. And as you know, the cases are going up. And at first, it seemed like students in schools wouldn't be affected. But we've seen cases where students are affected in schools. And my question first was, when the vaccines become available, what will the distribution of that look like? Who will be the first ones to get it? Will it be folks in long-term facilities, frontline workers, essential workers? And for someone like me who's a skeptic with vaccines, it seems like there's pressure, obviously, because we want COVID to be gone, for lack of a better word. What if will teachers be mandated to take this vaccine?
Right. Well, so that's a really interesting question. Yeah. And can I have Dr. Chagla kind of weigh in? Because these are both really important questions, and I want to make sure we have time to get to them. So the first one around teachers, and kind of where in line they might be for the vaccine.
Yeah, so the framework from the federal government really focuses, as was mentioned, on long-term care and vulnerable Canadians, so people that are at higher risk of dying or significant complication. They're healthcare workers that are on the front lines and that are in long-term care facilities, obviously to make sure, A, that they're not affected, but B, not bringing it in as well. And then we start seeing front-facing individuals, and that's where the teachers, the non-front-facing healthcare professionals, the firefighters, the policemen, the people that, still have to put their lives in front of other people as part of it. So, it is fairly high in the prioritization scheme,
right?
After we kind of deal with
Dr. Chagla,
the highest risk of dying populations.
I've got 10 seconds left just on the question of whether it could be mandated for teachers. Do you see that as being a realistic thing?
So this is going to be a regulated product. It's not going to be mandated. Everyone has an informed decision to make. With that being said, there are going to be settings where there is a risk to others associated with not being vaccinated. And so it may not be mandatory for day-to-day life, but if you're entering one of those settings, there may be some rules pushing one to get a vaccine in that sense.
Right. And I guess that we'll just have to kind of wait and see. Hurry up and wait, as I like to say. Shernette and McCleggan, thank you so much for your questions. Really, really smart ones. And we're going to have more questions from right across the country when we come back, including a special question about celebrating the holidays from Mark Rich.
Of course. But first, here's Leah in Rankin Inlet.
Yeah, Gibbons. I'm from Rankin Inlet, Nunavut. I'm mother of 5 children with 1 grandson. I'm a school bus driver. We had our first pandemic in March, and that was very hard for me to stay home. I was on E.I, and that E.I was not good enough as much as my pay, right? And now we have this second pandemic, so it's kind of hard too. I told my kids, don't panic. If we panic, it's just going to get worse. So we try and keep it calm. To cope it, we do some dice games, movie nights as a family, doing their homework, trying to do activities as a family. We're a religious family. We keep praying every day for each of us, for everyone.
Welcome back to the National Studio in Toronto for our special event, our virtual town hall, Confronting COVID. We are joined by our virtual audience joining us here on Zoom. They have so many questions, so do you. We've been putting them to our doctors throughout the evening who are standing by, and we have one very important question for them from a very shy fellow by the name of Mark Rich.
Hi, Mark Rich here in Halifax, Nova Scotia, but I live in St. John's, Newfoundland. I'm about to head home for the holidays, but the bubble just burst and I'm going to head to quarantine for 2 weeks. My question is, I've heard a lot about point of entry testing and exit testing. Which is stronger scientifically, and are either of them on the way so that people like me won't have to spend the holidays all alone?
All right, so the amazing Mark Rich, funny guy, serious question, Dr. Bogosh.
Yeah, it's a great question. Certainly we're learning more about how to use these tests and really perhaps shorten this quarantine period. And in fact, they're implementing rapid tests either at departure, at the point of arrival. And we know we can get the results back in as little as 22 minutes from some of those tests. But those tests are really only as good as if you have a follow-up test. So in some of the pilot projects being run in Canada, that has to be followed up with a test usually about 7 days later. But the initial test, either at departure or at arrival, isn't really good by itself. You need to have that follow-up test. It looks like at about 7 days. If all of those are negative, you're probably okay to shorten that quarantine. Now, that hasn't been implemented just yet widely across the country, but we might start to see those policies soon if the data shows that that's a safe thing to do.
All right, heard you say 22 minutes. Very clever, Dr. Bogosh. Thank you.
Now, tonight has been all about your questions, but next we have a question for you. We'll be right back. Welcome back. This is normally when we would bring you the moment. So tonight we thought we'd take a moment to ask what gives you hope as we near the end of 2020 and look ahead to 2021.
What gives me hope?
What gives me hope?
What gives me hope?
What gives me hope is other people's kindness, science,
the vaccine, beauty and tranquility of nature.
The younger generation.
What gives you hope at this time?
That things will get better.
The amount of empathy that I have seen.
People caring about human connection gives me hope.
What makes me smile, besides Christmas, is that we will persevere.
Smart Canadians out there to help us, including the 2 sons that I've raised.
What brings a smile to my face is my 5-year-old granddaughter.
My sister Maggie.
My children and my husband Pat.
My caring neighbors.
Time with my family.
Being able to talk and laugh with my colleagues, friends, and family, even if it's just through Zoom.
I love seeing their pets. I love seeing their babies.
One word to describe 2020, probably chaotic.
Pandemonium. Self-reflection.
Turning point.
Resilience.
Sacrifice.
Quarantine.
Crazy.
Weird.
Are we done? 2020?
I'm ready to ring in 2021.
That was great.
Can we watch it?
Of course we can.
Hi guys.
So good. And time for one more question from our virtual audience. Do the doctors have any things that keep their spirits up? Dr. Martin.
Oh, music, for sure. Can't a great song just transport you to a happier place and time and get you out of your head?
Perfect answer. That is a national for Tuesday, December the 1st. Thank you for joining us, and thank you for all your questions tonight.
Yeah, and to the doctors, thank you all for your insight. It's been wonderful tonight and really every night on this program.
And we will see you back here tomorrow night.
Good night.